Venous drainage of lower limb. The veins of the lower limb are divided into deep veins, superficial veins and perforating veins. Deep veins, they are present deep in the muscles. Below the knee, they are arranged as pair of venae committents along the arteries, and above the knee they run as single large vein. The deep veins of the lower limb include medial plantar vein and lateral plantar vein in the sole of the foot, dorsalis pedis vein on the dorsum of the foot, anterior tibial vein in the anterior compartment of leg, posterior tibial vein in the posterior compartment of leg, peroneal vein in the lateral compartment of leg, popliteal vein in the popliteal fossa, and femoral vein in the thigh. So the deep veins include medial and lateral plantar vein, dorsalis pedis vein, anterior and posterior tibial vein, peroneal vein, popliteal vein and femoral vein. The femoral vein continues as external iliac vein. Superficial veins. There are two major superficial veins which drains the lower limb. Number one, great saphenous vein. Number two, short saphenous vein. Great saphenous vein or long saphenous vein. It is the longest vein present in the body. It is a preaxial vein of the lower limb. Formation. It is formed by the union of medial end of dorsal venous arch and the medial marginal vein of great toe. So these two veins unite to form the great saphenous vein. Course. It runs upwards about 2.5 cm in front of the medial malleolus, and in the leg it ascends along the medial margin of tibia. In the knee, it lies post-medial aspect of the knee joint. In the thigh, it ascends along the medial aspect of the thigh and reaches the saphenous opening. This is the saphenous opening. It enters the saphenous opening by piercing the cribriform fascia and finally drains into the femoral vein by piercing the femoral sheath. Tributaries. The tributaries of the great saphenous vein are: number one, medial marginal vein of the great toe in the dorsum of the foot. Number two, anterior vein of the leg and posterior arch vein in the leg. And in the thigh, you have anterolateral vein of the thigh and posterior-medial vein of the thigh in the middle part of the thigh. In the saphenous opening, superficial circumflex iliac vein, superficial epigastric vein and superficial external podental vein. These drains into the great saphenous vein before it pierces the cribriform fascia. The deep external podental vein drains into the great saphenous vein before the great saphenous vein pierces the femoral sheath. So these are the tributaries of great saphenous vein. Short saphenous vein or small saphenous vein. It is one of the major superficial veins of the lower limb. It is a post-axial vein of the lower limb. It is formed by formation. It is formed by the union of lateral end of the dorsal venous arch of the foot and the lateral dorsal digital vein of the little toe. These two joins to form the short saphenous vein. Course. It runs upwards and behind the lateral malleolus. So it runs behind the lateral malleolus and ascends along the lateral margin of tendocalcaneus, and it runs on the middle of the posterior aspect of the leg where it pierces the deep fascia and undergoes a small subfacial course between the two heads of gastrocnemius, and finally it reaches the popliteal fossa where it drains into the popliteal vein. Tributaries. Number 1, lateral dorsal digital vein of the little toe in the foot. Number 2, medial and lateral calf veins. Perforating veins. They are communicating venous channels between the superficial veins and deep veins. They are called perforators because they pierce the deep fascia. They possess valves that allow unidirectional blood flow, that is from superficial veins to deep veins. There are two types of perforators: direct perforators and indirect perforators. Direct perforators, they connect the superficial veins with the deep veins directly. Indirect perforators, they connect the superficial veins with the deep veins through muscular veins. Location of perforators. Number 1, perforator of cocket or medial ankle perforators. They are 3 in numbers. They are situated between the medial malleolus and mid-calf. They connect the posterior arch vein with posterior tibial vein. Number 2, Boyd's perforator. It is present in the upper part of the leg, that is below the knee, and it connects the great saphenous vein with the posterior tibial vein. Hunterian perforator or adductor canal perforator, it is present in the lower 1/3 of the thigh and it connects the great saphenous vein with the femoral vein. Lateral perforator, it is present at the junction of middle and lower 1/3 of the leg, and it connects the short saphenous vein with the peroneal vein. Clinical anatomy. Varicose vein. It is a condition in which the veins are dilated and tortuous. There is pooling of blood in the veins. Usually, the superficial veins of the lower limb are varicosed. The varicose veins are due to incompetency of the valves present in the superficial veins or perforator veins. The incompetency of the valves of the superficial veins and the deep veins and the perforating veins are tested by Trendelenburg's test and Perthes test. Trendelenburg's test. In this, the patient is asked to lie down, the lower limbs raised, and the varicose veins are drained proximally by stroking, and pressure is applied at the saphenofemoral junction where the saphenofemoral valve of the great saphenous vein is present. The patient is asked to get up quickly. To test the superficial veins, incompetency of the valves present in the superficial veins, the pressure is released quickly. If the superficial vein starts to fill rapidly and if it results in varicose, the test is positive and the varicose veins is due to the incompetency of the valves present in the superficial veins. To test the perforating veins, the pressure in the saphenofemoral junction is kept intact for a minute, and if the veins starts to fill gradually and slowly, it shows the incompetency of the valves of the deep veins. Perthes test. In this, a tourniquet is applied at the upper part of the thigh to occlude the saphenous vein but not the femoral vein. The patient is asked to do gentle exercise like walking. If the valves present in the perforating veins and deep veins are normal, shrinking of the superficial veins will take place. Else, it will result in gradual filling of the superficial veins, and you can see the varicose in the superficial veins, which shows that there is incompetency in the valves of the perforating veins. Thank you.